What I am about to share is going to change the way you look at every single blood pressure pill sitting in your medicine cabinet right now. If you are taking Amlodipine, Losartan, or Lisinopril, there is a very real chance that one or more symptoms you have been dismissing as aging, stress, poor sleep, or just a difficult week is actually your body trying to tell you something specific about how your medication is affecting you, something that nobody fully explained when the prescription was written. And here is what troubles me most about this. People do not usually get into serious trouble with these medications because they were prescribed incorrectly. They get into trouble because they do not fully understand what the medication is doing inside them, so they miss the signals until something serious happens. My name is Dr. Favor Adewumi, and this channel is dedicated to bringing you the latest research on senior health in a way that is clear, practical, and genuinely useful. If you have not subscribed yet, please do that now, because what I am covering today is exactly the kind of information that protects the people closest to you. Stay with me through to the end, because after I walk you through what these 3 medications are doing inside your body, I am going to give you 5 specific questions that every person over 65 on blood pressure medication should bring to their next appointment. These questions can genuinely change how you are being managed, but they will only make sense after you understand what I am about to explain. These 3 medications are among the most prescribed drugs in the world. Amlodipine belongs to a class called calcium channel blockers. Losartan belongs to a class called Angiotensin Receptor Blockers. Lisinopril belongs to a class called ACE inhibitors. All 3 lower blood pressure through different mechanisms, and all 3 are considered safe and effective when used correctly. But here is what most seniors are never told. After 65, the body handles all 3 of these drugs differently than it did at 45. The liver and kidneys, which process and remove drugs from the body, slow down with age. This means medications stay in the bloodstream longer and reach higher concentrations per dose than they would in a younger person taking the same amount. The result is that side effects, which might be mild and temporary in a 50-year-old, can be more pronounced, more persistent, and more dangerous in a 70-year-old on the same dose. But here is what most people do not realize. None of those side effects come with a label that says, "This is your medication." They arrive as tiredness, dizziness when you stand up, leg swelling, dry cough, or just a general feeling that something is not quite right. And because those sensations also match the experience of getting older, they get dismissed every single day by patients, by families, sometimes by the doctors themselves in a 7-minute appointment. Let me walk you through each medication specifically because the signals are different for each one. Amlodipine works by relaxing the smooth muscle walls of the blood vessels, making them wider and reducing the pressure needed to push blood through them. This is highly effective, but the same mechanism that widens blood vessels also causes fluid to shift into the surrounding tissue, particularly in the lower legs and ankles. Ankle and lower leg swelling affects a significant proportion of patients on amlodipine, particularly at higher doses, and it is one of the most dose-dependent side effects of calcium channel blockers. This swelling is often dismissed as a circulation problem or just getting older, but here is the specific concern for seniors. When ankle swelling from amlodipine is mistaken for a new cardiovascular problem, some patients end up being prescribed a diuretic, a water pill, to manage the swelling. And the combination of a diuretic with amlodipine in an older adult can cause blood pressure to fall too low, particularly when standing up, leading to dizziness, lightheadedness, and falls. Falls in adults over 65 are the leading cause of serious injury and death, which is why this cascade matters. Amlodipine can also cause excessive tiredness and flushing, a feeling of warmth, and in some patients, worsening of urinary symptoms. If you are on amlodipine and experiencing any of these, do not stop the medication on your own, but document the symptoms and bring them to your doctor because a dose adjustment or a switch may be appropriate. Losartan blocks a specific hormone system called the renin-angiotensin system, which regulates blood pressure and fluid balance. It is one of the most widely used blood pressure medications in older adults and is generally well tolerated, but there are specific risks that are more relevant after 65. The first is hyperkalemia. That is the medical term for elevated potassium in the blood. Losartan causes the kidneys to retain potassium instead of excreting it. In a younger person with healthy kidneys, this is managed efficiently. In an older adult whose kidney filtration has naturally declined, and especially in someone who eats a high potassium diet of bananas, oranges, potatoes, and tomatoes, potassium levels can rise to levels that affect the heart rhythm. The symptoms of elevated potassium include muscle weakness, fatigue, and irregular heartbeat, and all three of these are easy to attribute to other things. This is where things become dangerous because elevated potassium can become a cardiac emergency without clear warning. The second specific risk with Losartan in older adults is blood pressure falling too low, particularly when combined with other blood pressure medications or with diuretics, especially during illness. When an older adult on Losartan has a stomach illness with vomiting or diarrhea and stops eating and drinking, dehydration lowers blood pressure further. The Losartan is still working. Blood pressure can drop to unsafe levels. If you are on Losartan, your doctor should have given you specific guidance about what to do if you become acutely unwell. If that conversation never happened, bring it up. If you've made it this far, you're clearly invested. You want to see what happens next, but most viewers enjoy the content and scroll away without subscribing. If this one really means something to you, tap subscribe. It takes a second. If not, you'll probably forget this channel exists and miss a lot of great educational content ahead. Over the years in my clinic, I have seen one simple truth. Real progress does not come from doing anything extreme. It comes from doing the right small things consistently every single day. That is exactly why I created the 30-day blood pressure reset for seniors. It is a simple step-by-step plan designed to help support healthy blood pressure through gentle daily routines, light exercises, and clear guidance you can easily follow at home. What I have learned from years of working with patients on these medications is that the people who do best are not the ones taking the most aggressive doses. They are the ones who combine appropriate medication with consistent daily habits that reduce the amount of work the medication has to do. When lifestyle genuinely supports blood pressure, medication needs can sometimes be reduced under medical supervision, and side effects naturally diminish as doses come down. Some of my patients and people who have already gotten the guide have followed this exact structure and started seeing real improvements. You will see some of their feedback on your screen. Many have shared that they feel more in control of their daily habits, more confident about their readings, and more at peace knowing they are finally doing the right things. For many of them, it was not about drastic changes. It was about having a clear, simple plan they could actually stick to. I am only allowing 15 people through it right now. Click the link in the description or scan the QR code before all the spots are filled. And because you are part of this community, I have made it easier with a 70% discount. After you get your copy, drop your email and I will personally follow up with you. And if these videos and guides have been helping you, you can also support this community through the link in the channel description. Your support helps us continue creating simple health education for adults over 60 who may not always get enough time, guidance, or clear explanations elsewhere. Now let us talk about Lisinopril because this one has a signal that most people misidentify for years. Lisinopril belongs to the ACE inhibitor class. ACE inhibitors work by blocking an enzyme that causes blood vessels to tighten. Blocking it keeps vessels more relaxed and blood pressure lower. They are also prescribed to protect the kidneys in people with diabetes and to support heart function after a heart attack. The most well-known side effect of Lisinopril is a dry, persistent, irritating cough that affects between 10% and 15% of people who take it. This cough occurs because the enzyme that Lisinopril blocks also normally breaks down a substance in the lungs called bradykinin. When bradykinin builds up, it irritates the airway lining. The cough can start weeks or months after beginning the medication. It is non-productive, meaning no mucus. It is often worse at night. And the biggest mistake comes when patients, and sometimes their doctors, spend months investigating this cough as a respiratory problem before connecting it to the medication. Allergy tests, inhaler prescriptions, and chest x-rays are ordered before anyone asks whether the patient started a new blood pressure medication recently. If you have been on Lisinopril for more than 3 months and have developed a cough you did not have before, ask your doctor directly whether this is a Lisinopril cough. Switching to a drug class called Angiotensin Receptor Blockers, of which Losartan is an example, resolves this cough in the majority of patients within a few weeks. The second concern with Lisinopril in older adults is a rare but serious allergic reaction called angioedema. This is a sudden swelling of the face, lips, tongue, or throat that can, in severe cases, block the airway. It is uncommon, occurring in less than 1% of patients, but it can happen months or even years into treatment with no prior warning. Any sudden facial or throat swelling in someone on Lisinopril is a medical emergency. Stay with me because this next point could be the most important one. The biggest mistake that older adults on these 3 medications make is not knowing what monitoring should be happening. These medications require periodic blood tests to catch problems before they become emergencies. Anyone on Losartan should have their potassium and kidney function tested at least every 6 months. Anyone on Lisinopril should have the same. Anyone on Amlodipine experiencing ankle swelling should have their dose reviewed annually. Anyone on any blood pressure medication who has added a new medication, has changed their diet significantly, has experienced an illness involving vomiting or diarrhea, or has started taking NSAIDs, like ibuprofen for pain, should contact their doctor because each of these situations can significantly alter how the blood pressure medication behaves. And here are the 5 questions to bring to your next appointment. First, are my potassium and kidney function being tested regularly on this medication? Second, is my current dose still appropriate, given my age, kidney function, and any recent changes in my health? Third, are any of my other medications affecting how this blood pressure medication works? Fourth, what should I do if I become acutely unwell, such as with vomiting or severe diarrhea? And fifth, are there any lifestyle changes that might allow a dose reduction in the future? These 5 questions, asked directly at your next appointment, create the kind of personalized, informed conversation that protects you in a way that a standard follow-up often cannot. Let me summarize what you now know. Amlodipine commonly causes ankle swelling that is often mistaken for a circulation problem, and the combination of amlodipine with diuretics can lower blood pressure dangerously in older adults. Losartan can cause potassium levels to rise silently, particularly in seniors with mild kidney decline or high potassium diets, and blood pressure can fall dangerously low during illness. Lisinopril causes a persistent dry cough in a significant proportion of patients, which is often misdiagnosed for months and carries a small risk of sudden throat swelling that requires emergency attention. All 3 medications are effective when properly managed. What makes them safe is not just the prescription, it is the ongoing monitoring, the informed conversation with your doctor, and the daily habits that support blood pressure from the lifestyle side, so that medication doses can stay as low as effectively possible. Before you go, think about this for a moment. Most people keep waiting for the perfect time to take their health seriously, but that moment usually never comes. That is exactly why I put together the 30-day blood pressure reset for seniors. It is designed to help you follow a simple, structured daily routine that supports healthy blood pressure without confusion or stress. Inside, you will find gentle exercises, practical daily habits, and a clear step-by-step plan you can actually stick to. Some of my patients and people who have already gotten the guide have followed this exact structure and started seeing real, noticeable improvements. You will see their feedback on your screen. Many have shared that they feel more in control of their habits, more confident about their readings, and more at peace. For many of them, it was not about drastic changes. It was about having a clear and simple plan they could follow consistently. I am keeping this very limited. Only 15 spots are available and 5 are already gone, which means just 10 spots are left. Once those spots are filled, I will close it. Click the link in the description or scan the QR code to secure your spot now. And because you are part of this community, I have made it easier with a 70% discount. After you get your copy, drop your email and I will personally follow up with you. And if these videos and guides have been helping you, you can also support this community through the link in the channel description. Your support helps us continue creating simple health education for adults over 60 who may not always get enough time, guidance, or clear explanations elsewhere. Every bit of support helps us keep this community growing and continue helping more seniors take better care of their health with confidence. Tell me in the comments, which of these 3 medications are you currently taking? And did you know about any of the side effects I described before today? I read every comment. I am Dr. Favor Adiemi. Understanding your medication is not optional. It is part of staying safe. I will see you in the next one. Disclaimer, everything shared in this video is general educational information based on published research, including GoodRx Health Amlodipine Side Effects Review, updated February 2026, Mayo Clinic drug information on Amlodipine, Losartan, and Lisinopril, updated May 2026. Single Care Medical Review of Losartan and Amlodipine, published November 2024, and StatPearl's Clinical References, 2024 and 2025. Amlodipine, Losartan, and Lisinopril are all effective, widely used blood pressure medications. The side effects described are documented in clinical literature and are presented here to support informed conversations with healthcare providers. Do not stop, reduce, or change any of these medications without speaking to your doctor first. Changes made without medical supervision can result in serious cardiovascular events. This information is educational and does not constitute personal medical advice.